Hi, this is Yaffi Lvova, registered dietitian nutritionist and owner of Baby Bloom Nutrition. And this is a follow-up on my nap time nutrition segment from Tuesday when I was talking about breast is best and fed is best. So the overall conclusion of that talk and this one is, what do you do when your baby's hungry? You feed your baby. And we don't shame each other. We provide the best nutrition that we have available in our situation and what provides the most nutrition and sanity for our family. So today, last time I went over what those movements are, the fed is best and breast is best, and why we need both of them and why they're not mutually exclusive. And today I want to address the initial question that started me on that path, which is, what do you do when your infant is gaining weight slowly? Well, first let's talk about what expectations are from a newborn. And I'm talking about from the hospital. I'm not talking about 2 weeks old, 3 weeks old. I can get into that, but this is really focused on you have just had a baby and you are still in the hospital. What's going on? The expectations is that your infant is going to latch for 20 minutes, 8 to 10 times a day in a 24-hour period. Well, per day, yeah. The main way to determine if your child is getting enough nutrition is by wet and dirty diapers. On the first day of life, you want 1 wet diaper. On the second day of life, 2. On the third day of life, 3. By the 4th day of life, you're going to have 6+ wet and dirty diapers. And at that point, the poop is going to start to turn a yellow seedy color if you're breastfeeding, and you're not going to have meconium at that point anymore, which is the black stuff, that fun black tar that you're getting at the very beginning. The infant should regain their birth weight by 10 to 14 days. Well, what does that mean, regain their birth weight? Most infants, by far, are losing some amount of weight when they're first born. The amount depends on a lot of situations. The accepted amount, the amount that's acceptable is 5 to 7%. Some hospitals have a threshold at 10%. And after that, they're really going to suggest some kind of milk alternative supplementation. The amount of weight that your infant loses depends on what type of delivery you had and if you had fluids during the delivery. For instance, if you had a normal, healthy vaginal delivery with no fluids administered, that's going to give you a fairly accurate birth weight. But if you had a cesarean and you had a lot of fluids administered getting you ready for that, that's going to artificially increase your baby's weight, which means that over the first day, 2, 3, their weight loss is going to be a little bit artificial and blown out of proportion. So that's something to keep in mind, and you can have an open conversation with the pediatrician at the hospital about that and about your concerns. You should feel free to feel open and confident to have an open conversation with the doctors about anything that concerns you while you're in the hospital. Well, and after, for that matter. After the first 3 to 4 days, they're going to start to gain weight again. You're going to expect 4 to 7 ounces per week of weight gain. And if you're not seeing that, you really want to talk to a lactation consultant or your doctor. There are a lot of different factors that affect how much your baby is going to gain or how little. And it's an overall picture. If your baby is active and engaged and showing all the other healthy signs, maybe their weight gain is a little bit slower, and that's okay. But if they're starting to be listless, if they're starting to sleep more than 20 hours a day, there could be a sign that something's wrong, and I will get into what those signs are. But this is something you really want to talk to your doctor about. If you are concerned, more often than you have pediatrician appointments, you can go to a lactation consultant's office, you can go to your pediatrician when you don't have an appointment, just for a weight check, and lots of people do that. When you're in the hospital, the protocol is to check their bilirubin 1 to 2 times depending on the situation during your stay. And the bilirubin is an indication of liver function, and it helps test level of jaundice. Jaundice is when the skin is a little bit yellow and the eyes are yellow, and that shows that the liver has not completely taken up the task of breaking down red blood cells the way that it's going to. And that's going to impact nutrition. It could cause your baby to not be as interested in eating, and it is actually solved by them eating more, and also by UV lights depending on the severity of the situation. So the hospital is going to be checking that at least once. And that's not a blood test. They use a little light and put it on their forehead. It's actually pretty cool. It's nice technology. The hospital is not going to check blood glucose unless your baby or you is at risk. And at risk is if you have any type of diabetes, whether type 1, type 2, or gestational, or if the baby is small, or if the baby was large at birth. And if the baby is symptomatic, meaning if the baby is showing signs that they're jittery at all, they're going to check the blood glucose at that point, which is blood sugar. They're not going to check that automatically. There's no protocol to check automatically. There will be a daily wait to check on the progress of the baby. Your behavior expectations for your newborn infant fresh out of the womb, they're going to sleep up to 20 hours, and that's going to come in increments of 20 minutes to 3 hours, depending, maybe 20 minutes here, maybe 3 hours there. If it's getting to be a little bit longer than that, you might be encouraged to wake your child for feedings. They're going to cry. They're going to cry for a few different reasons. But if they cry inconsolably and constantly, there could be an issue to address. And any hiccuping, sneezing, yawning, spitting up, burping, and gurgling is totally normal and expected. They're going to have certain reflexes that are actually fun to test. The rooting reflex, where they're looking for a nipple, the sucking reflex, where they're sucking, obviously, the startle reflex, and there are a few more. There are a few more reflexes that are going to be present that you can talk to your doctor about. One of them is if you put them, let's see if Daniel will do it. He's a little bit old for this, but you put him on the table and they start to kind of walk. Nah, he must have lost the reflex already. I also saw one where you put the baby from the waist down, obviously holding him in a tub of water, and they walk along the bottom. It's very cool. Signs of dehydration and malnutrition in an infant. Improper latch or suck. Most hospitals at this point have a lactation consultant who is available to inspect your situation and tell you what's going on. And it's really good to at least have a conversation with them. It's also good to establish a relationship with a lactation consultant before going to the hospital and having your baby, so that you have that connection when you get out. I found that to be really helpful. When the baby is attached, the baby should be active and enthusiastic. And again, this should be happening 8 to 10 times in a 24-hour period at the very beginning. And as the baby gets older, you're going to be feeding less as their stomach gets bigger. But at the very beginning, their stomach is so small they can't fit that much nutrition in there, so they get hungry pretty often. If the baby's sleeping constantly, if the baby is inconsolable, or if the activity level of the baby is decreasing over time, those are all signs of dehydration or malnutrition and should be discussed with your doctor. And again, if that means the day that you get out of the hospital, you're on the phone with the doctor, that's what it has to be. You have to be sure that your child is getting the proper nutrition. It's not often that a woman actually does have a physical problem preventing her from making breast milk, but it does happen. And there are a lot of factors that could help you, that could put you at risk otherwise for having delayed lactogenesis too, which means your milk, you have the colostrum, that the actual milk production starts during the pregnancy. But lactogenesis 2, which is like milk production phase 2, starts after your colostrum, and it's when your milk comes in. And there could be a delay for that, and that could put your infant at risk for malnutrition, and there are certain risk factors. So I'm going to give you a huge list here. Retained placental fragment. If your entire placenta did not come out and some of it is still inside of you, that could cause, that was fun. That could cause delayed lactogenesis too, which means your milk is not going to come in as early as it should. And when should it come in? It should come in by 3 or 4 days of life. If you've had earlier pregnancies, it might come in earlier than that. With Daniel, mine came in at a day and a half, which was really shocking. Before, with my twins, it came in at the expected 3 to 4 days. Any type of diabetes is going to affect your milk production. It's a hormonal disorder that is going to affect it. And other hormonal disorders include PCOS and obesity, hypothyroidism, or other pituitary problems. Those could all cause a delayed production of milk. Any breast surgery, either an increase or a decrease, could affect your mammary glands, causing a delayed or failed production of milk. Did your breasts increase in size during pregnancy? That's a good sign. If they didn't increase in size during pregnancy, that's something to discuss with your doctor as far as if you are going to be producing milk, if you have started, it's something to discuss. If your baby was preterm, or if you delivered by C-section, there may be medications involved that could delay your milk production. There could be physical barriers, either with the mother, the nipples, or the baby. I've gone over tongue tie and lip tie, also cleft palate. That's a huge one. They're going to have with cleft palate, they're not going to be able to suck. You'll have to feed an alternate way. But with a lip tie and a tongue tie, it is possible to breastfeed depending on the severity and the restriction of the ties. Those are good to get taken care of. I did an entire nap time nutrition on that. You can check that out if that's something that's a challenge for you. Congenital heart defects, delayed first breastfeeding session. If you weren't able to breastfeed right away and that was delayed by a good amount, that could delay your milk coming in as well. And if you're a smoker, that could delay your milk coming in. Another big one is psychosocial stress and pain. That could be if you had an unplanned C-section and that's causing you a lot of emotional stress, that will affect your milk. If you have postpartum depression or other types of depression, anxiety, too much family drama, too many visitors, that could all affect your milk coming in. So it's good to know where you are, where you are mentally, where you are emotionally, in order to keep that in check, to make sure that your body responds. It can be difficult to have milk production when you're feeling like you're under a lot of stress. And becoming a new mother, even becoming a mother for the third or fourth or ninth time, that could cause a problem emotionally and could cause a delayed milk response. So I hope this answered a lot of questions. If you have any concerns, discuss it with your lactation consultant and or your physician. And if you have any experiences with this, please comment below. I'll be back for nap time nutrition on normal time on Tuesday at 1 p.m. Arizona time, 3 p.m. East Coast time, GMT -7, 9 a.m. on Wednesday, New Zealand. And you can follow me at babybloomnutrition.com, on Facebook right here. I'm on Instagram, babybloomnutr, and Twitter, which I never use. I should learn. So I hope to see you back, and I'm always open to suggestions on topics. Thanks.